the only Indian network that has been reporting on the outbreak from day one. There is panic in India after more cases have emerged. What are the symptoms of the disease? What should someone do if they are sick? Like we have been saying, prevention is better than panic. And we at WION have compiled a list of the frequently asked questions and their answers. This is information that you can use in the fight against the disease. Question number 1 is, what are the symptoms? Those who have been infected suffer from coughs, fever and breathing difficulties. The symptoms could take up to 14 days to appear. The coronavirus can cause pneumonia. Runny nose, which is typical of a cold, has not been reported as one of the obvious symptoms. Question number 2, what can you do if you feel sick? The WHO recommends turning to your local hospital for the right advice. Indian citizens can take some additional steps as well. The government of India has now set up a 24/7 helpline number, and there is also an email ID. If you or anyone around you are showing symptoms, then or have traveled to areas affected by the outbreak, inform the government helpline, stay indoors and avoid public places. Question number 3, how deadly is the coronavirus? Diseases like the Wuhan Virus, SARS and MERS belong to the same family. They are all coronaviruses. The Wuhan coronavirus is deadlier than the seasonal flu, but not as deadly as SARS. The global rate of mortality is around 3.4%. SARS had killed about 10% of the infected individuals. MERS was worse. It had a fatality rate of about 35%. So the Wuhan coronavirus is not as fatal, but it travels fast. The most commonly asked question, do face masks help? While they do not guarantee total protection, experts do recommend using one. The virus transmits through droplets when one sneezes. If you are close to someone who has been infected, the mask can't stop the disease from being passed on. And if you are showing the symptoms, wearing a mask can also protect others. Question number 5, is there a cure? So far, there is none. There is no approved drug for the disease, but several are being tested. Reportedly, a vaccine is under development as well, but that could take about 18 months to hit the markets. So how are the doctors treating the patients then? According to reports from last month, the doctors are using a combination of drugs and methods to treat the patients. Reportedly, more than 50,000 patients infected around the world have now recovered. Finally, we would like to suggest some precautions. How can you protect yourself? Wash your hands, that's a basic, with clean water and soap. Hand washing is the best available option, and if that is not possible, one can use wipes or hand sanitizers. Cover your mouth and nose when you cough or sneeze. Seek medical help if you have fever, cough, or if you feel difficulty in breathing. Share your travel history with your doctor during the checkup. If you are visiting any affected areas, avoid direct, unprotected contact with live animals or surfaces that were under contact with animals. Avoid eating raw, undercooked animal products. That does not mean, however, that you need to avoid non-vegetarian food altogether. As long as one is properly cleaning and cooking the food items, they should be safe.